Association is to direct our public policy and our legislative advocacy. So I interface a lot with the state legislature and the staff who work in the Capitol building, who focus on health policy. So that's really my role. And really with the new administration, Governor Jerry Brown, the vision of what the role of state versus local government, what those different roles are, has been really reimagined for the state government, both elected officials and for counties. So, really starting last year when he was elected, one of the major things he initiated was to help bail out the state budget by realigning a lot of programs to the local government level instead of having them be part of what the state is responsible for funding in the state budget process each year. And he, really talked a lot about certain themes that he felt were values about what the role of state versus local government is, and that from his perspective, particularly having been not only a governor many years ago, but then spending time as a local elected as the mayor of Oakland, felt like decisions are best made about what government programs should look like and how money should be spent at the local level, where people know their unique communities and how money ought to be spent to deal with what that community needs. So I think part of what the themes are and what he's talking about and what Sacramento elected officials are really weighing in on is what is the appropriate role for the state to play in overseeing what all those local programs look like. In California we have 58 counties, so should there be a variety that is totally unstructured from the point of view of the state, or are there certain things that the state wants to make sure at a minimum, no matter where you live, there's a certain expectation of what kinds of health care you should expect to receive and what kinds of public safety programs keep our streets safe and our communities safe. So it seems to me though that a lot of this is sort of a pendulum that swings. If you look historically at the idea of devolution, of sending things from a higher level of government down to the local level, it seems like the pendulum just sort of swings every number of years, one way or the other. Even in the way that departments get structured at the state and local level, sometimes in the area of social services and health, there's a great big huge department that oversees all of it, and in other cases they're all individual siloed approaches, and then that structure gets criticized for being good or bad for consumers, and then they blow it up and turn it the other way and sort of flip it around. So it seems to me that I have somewhat of a it's not really cynical, but I'm sort of tentative on picking sides on whether I think things are better really structured at the state level versus locally controlled, because to me it seems like the pendulum just sort of swings one way or the other. And so but I do think that many of the programs that are being sort of realigned and sent to the local level to manage, I think there might be a perception that there's going to be a ton of variety across every county on what those programs will look like. But in reality, for most of the health and social services programs that social work students would care about, most of those programs will look pretty much the same in terms of what services are supposed to be offered, who's eligible to receive them, because they're federal programs, they're Medicaid programs, they're child welfare programs, and a lot of those programs are actually set up at the federal level. So the state, sort of receives the funds and has to comply with those federal requirements. And really what's happening is the state government is now saying it will be up to counties to manage all those federal requirements on behalf of the state, rather than the state having to do that and assure to the federal government that it's the state's job. So now it will be each county.
I think that the thing that worries me the most is that all of the strides that we've made, particularly in the field of mental health, may be lost, and if we don't actively participate in developing the things that support policy change, like outcomes, and demonstrating what we do and having a good message about that, and developing business plans that are based on evidence to say that what we do works, that we will not exist as a specialty mental health field. And so I think it's incumbent on us to pay attention as the state seeks to shift financial responsibility for healthcare in general to the local counties and to the feds. We could lose the whole specialty field, and I think that it's about more than our individual jobs. It's about what happens to the people who really need the services. And are we going to go back to archaic methods in addressing the issues, or are we going to move forward and identify better and better ways to deliver those services?
Well, clearly, for me, it's the funding. In Trinity County, we're a very small county. Alcohol and other drug and mental health together, we only have about a $4 million a year budget. We can offer quality services, but the funding to keep that going, particularly the realignment, it's about a third of our revenue. And so what happens in the coming year in terms of the governor's wishes around how that's going to be sustained, that's critical. It's critical to all the counties, but especially a small county where we're really hand-to-mouth when it comes to our budget. We don't have reserves other than our prudent reserve, and it's going to be important that we can keep our doors open and serve the community.
We have some of the largest policy changes happening this year that we've ever had in my almost 30 years of working in public mental health. We have the whole realignment issue of funding and oversight from the state to more of a local level. We have the whole AB 109 prisoner release project, and it's not really prisoner release, but Scott will tell you more about that in the class. So we have so many major changes to our system this year that I can't say one's more important than the other because they all come together. And really, honestly, funding drives so much of it. So there's no way to get away from funding.
What worries you the most about all that?
Losing our specialty mental health service, getting absorbed into integrated healthcare in such a way that we lose the true community mental health aspects that we know how to do and we do well. Physical health care doesn't do the kind of case management that we do. They don't know how to help somebody get a job who hasn't worked in 30 years. They don't have that breadth of knowledge of how to help somebody work within some challenges that they have due to a mental disorder and help them become part of the community. I'm really afraid of losing the ability to do that flexibly, responding to the needs of the clients and their families. I'm sorry, but physical health doesn't do that. Right. And I'm very afraid of it getting lost through the whole healthcare reform, the need for that
transfer of a lot of responsibility from state government to local governments and counties specifically. And I think probably the greatest concern about that is if there's going to be additional resources available to really meet our clients' needs, to meet our obligation to the federal government for Medi-Cal services. And probably the biggest concern I have is around drug and alcohol funding and availability of funding for both our clients with dual diagnosis as well as the drug and alcohol clients, which are also part of our clients.
I'm very worried about shifting responsibilities from the State Department of Mental Health, the state alcohol and drug programs, to the counties with inadequate funding. So the responsibilities stay more or less the same, but the funding is being reduced. I think that puts the county behavioral health departments in a very awkward position. We're completely dedicated to trying to provide all necessary services, and without adequate funding, we're being squeezed. I also think another challenge is to elevate behavioral health into the public safety realm. I believe that alcohol and drug abuse, mental illness that is untreated can lead to highly dangerous behavior and cause a risk to public safety, and that we have very good, effective, cost-effective treatments that are available if we had funding.
Well, I guess what worries me the most about, well, two things. One is the elimination of the State Department of Mental Health. While I think it's been a very dysfunctional State Department for quite a while, the transition is not clear to us. We don't really know who at the state level is going to be taking over, and having the kind of expertise that we need at the state level to perform the state functions of oversight and evaluation, and just to make sure that the state's role is carried out with regard to mental health policy. What I am most concerned about, aside from that, and not knowing really who to be working with at this point, is that counties now have a huge responsibility in carrying out realignment. The state has spoken, the governor's spoken, the legislature has spoken, and they've said we want to return responsibility for a variety of issue areas to the local level. That means that counties, more than they've ever been before, are really in charge of their own destiny, and the success or failure of the programs that have been realigned to them really rest on their shoulders, and they can't be blaming the state as much as probably they have in the past for the successes or failures. It also means that along with their program responsibility is transferred the financial risk, and that is also a tremendous responsibility at the local level to be able to do a better job than the state did in managing these health and human services programs, but also to be able to manage the financial risk and do what they need to do in a more cost-effective way and still provide the services to the people that need services, particularly the mental health safety.